Hello, good morning. My name is Chandana Gajjala. I'm from Data Science Department, and this project is about information retrieval in healthcare. And this is the process of obtaining relevant medical information for large databases or sources to support healthcare professionals' research and making the informed decisions. And it involves finding, accessing, the using health-related data and treatments, research, and patient care. And these are all the techniques of healthcare improve like outcomes by facilitating better access to information and supporting decision making process for researchers and patients. So it is all about enhancing the overall quality of healthcare delivery. And the importance of information retrieval in healthcare is plays a crucial role in healthcare by enabling the efficient extraction, management, and dissemination of medical data, which ultimately enhances patient care, research, and clinical decision making. And there's so many ways. Uh, there is a key ways in which information retrieval is important for the healthcare. For example, it is like decision making and knowledge management, personalized care, and operational efficiency. For example, we can say the information retrieval in healthcare that ensures the healthcare professionals have access to the right information at the right time, leading to better patient outcomes like efficient care services delivery and innovative researches in all the operational efficiencies. Like we have so many unique needs and characters in each personalized care. In according to the knowledge management also we have like the healthcare providers will make us easy to share insights and better growth across the industry. So likewise operational efficiency also makes the administrative tasks and they enhance the overall productivity of healthcare organizations. And let's we go for the fundamental concepts of information retrieval. So the fundamentals of concepts of information retrieval, it is like a large collection of unstructured and semi-structured data. It all the fundamental concepts of information retrieval can be broken down into several key areas like information indexing, query formulation, relevance ranking, and when go for the information indexing, we have like a tokenization, stemming, stop words, etc. Like stemming means it is like a smaller unit, splitting the text into smaller units. Like it includes the natural language processing and machine learning also. When come to this stemming, it is like a reducing words to their base or root form. So like stop words, common words like and, the, etc. It is like an ignored during indexing. So it is not that contributed much to research relevances. And uh, we also have the ranking and relevance ranking. So we have the query formulation and the relevance ranking has the algorithms and techniques and like determining the most relevant and valuable information based on user and the other queries considering the factors such as content context and the preferences. And this involves understanding how to represent the documents and queries. Like indexing shows the storing data efficiency and the relevance ranking shows the evaluation the system's performances. So every fundamental concept plays a key role in information retrieval. So meanwhile the natural language processing and machine learning improves search efficiency and improves the accuracy in various domains. And when we go for this methodologies and techniques, we have the keyword based research, semantic search, content based retrieval, and everything. Like if we take the clinical term recognition, like content based retrieval, we have the system identifies and map terms. Like it is enabling accurate retrieval of information, even it is in different terms. So we have like semantic research. So in semantic research, it is used to identify hidden relationships between like a patterns of word and documents. So it could help retrieve related documents even if the search terms does not appear in the text or something. So in this semantic research, we have like some models like a vector space model and word embedding and deep learning. So vector space model plays a key role by similarity between query and document. So it is measures using cosine similarity or other distance metrics. So it improves the search by capturing semantic relationships between words, allowing more accurate retrieval even where it has a terminology and phrasing. And information retrieval challenges in healthcare. So we have like a data heterogeneity, privacy and security, terminology and ambiguity, continuous innovation, and everything. Like if we if we have making the challenges to integrate and retrieve information effectively, we have to use the privacy and security in implications with when designing the complex specialized languages. So the continuous innovation plays role in methodologies and techniques. Therefore, the systems often evaluated based on real world clinical utility. So the continuation innovation will help to keep up with the changing landscape. So next topic is machine learning and AI in healthcare. It's gonna be take our teammate Kiran Reddy Konapalli.
Hi, I like to explain about machine learning and AI in healthcare here. Coming to intelligent search, AI-powered search understands query intent for better results. For example, IBM Watson helps the doctors find relevant research papers quickly, and the data analytics, which in machine learning extracts insights from vast healthcare data. For example, predictive analytics in hospitals can forecast patient readmissions. Coming to the natural language preprocessing, which enables computers to understand and generate human language. For example, chatbots like Ada help assist in symptom checking. Coming to computer vision, the AI analyzes medical images like X-rays, MRIs, and CT scans. Example, Google DeepMind's AI detects eye diseases from retinal scans. Coming to next slide, healthcare data analytics. The main objective is extract meaningful insights from medical data to improve healthcare outcomes. The main applications are predictive analytics, descriptive analytics, prescriptive analytics, and big data healthcare. Uh, Coming to predictive analytics, these forecast disease outbreaks, hospital admissions, or patient deterioration. And coming to descriptive analytics, identify patterns in patient records for better treatment planning. Prescriptive analytics is AI-driven recommendations for personalized treatment, and the big data in healthcare, which is using Hadoop, Spark, and cloud computing for large-scale data analysis. Example, using AI to analyze past patient records and predict sepsis in ICU patients. Yeah. Coming to next slide, ethical consideration in healthcare IR. The privacy and confidentiality is the most important thing to maintain the healthcare IR, which protecting patient data while ensuring efficient information retrieval. Example, hospitals use password protector systems to keep medical records safe. And the same thing, the bias and fairness, preventing AI from amplifying biases and ensuring equitable healthcare. For example, AI should recommend treatment equally for all patients, not favor certain groups. And transparency and accountability, which promotes openness in AI development and establishing clear responsibility. For example, doctors should understand how AI suggests a diagnosis, not just blindly trust it. The main importance of these are keep patient data safe and prevents misuse, ensures fair treatment for all patients, avoiding discrimination, builds trust in AI so doctors and patients feel confident using it. Coming to the next slide, there are challenges too in information retrieval for healthcare. The patient data privacy and rules, which are the HIPAA keeps medical info private. The GDPR controls who can access personal data. The HL7 and the FHIR rules for secure data sharing. The IR system must follow these rules while quickly finding patient records, test results, and images. And the medical record is mostly unstructured. Medical data comes in many forms: EHR, doctor notes, prescriptions, test results, the medical research, which are papers, guidelines, the imaging reports, which are X-rays, MRIs, and CT scans. Coming to the next slide, which are tools and libraries for healthcare here. Uh, there are talks and which are the libraries and framework used for the those talks. Uh, NLP for medical text. We use Spacey, Biobet, Clinical Bet, MedBet, text retrieval and ranking. We choose Elasticsearch, BM25, TensorFlow ranking, and XGBoost. Medical image retrieval, Torch Vision, Decom Toolkit, Radlex, and PACS. The EHR analysis, FHIR API, HL7 standards. Deep learning for healthcare. The libraries and frameworks here, TensorFlow, PyTorch, and Force. And thank you. And next, followed by Satish Kumar Reddy Palavalli.
IR applications in healthcare. The goal of the IR applications in healthcare is assist doctors in diagnosis diseases, recognizing treatment, and retrieving relevant patient data. The IR applications works in the four steps like they are query processing, semantic matching, information retrieval technologies. Fourth one, ranking and recommendations. In summary, IR in healthcare enhance the accessibility of clinical health information, improve patients' outcomes, aids in clinical diseases making, and support researches and policy development. Coming to the next slide, medical literature search in and some summarizations. The main goal is enhance search engines for the retrieving research papers and medical guidelines efficiency. It works in the four conditions. They are use query understanding, document ranking, and filtering. And the third one is summarization. For example, the tools are Assistic Search and PubMed. The medical literature search and summarizations are the essential process for keeping healthcare. Provides and researchers updated on the latest development in the medicines. The combination of efficient literacy search technology and advanced summarization methods plays a circular roles in the improving healthcare outcomes and advancing scientific knowledges. Coming to the next slide, disease diagnosis and symptom retrieval. Identity relevant diseases and conditions based semantic and entered by users. It works in the four conditions like NLP, unnamed entity recognition, knowledge graphs, and ontologies. Ranking and scoring. In conclusion, the disease diagnosis and symptoms retrieval is a circular process in healthcare that helps to healthcare providers identify conditions based on the patient's symptoms and clinical data. Advantages in technologies, including artificial intelligence, machine learning, and natural language processing, have scientific enhanced the accuracy and the efficiency of the process. Coming to the next slide, patients record research in the EHRS. The goal is doctors to efficient search and retrieve specific patient data. It works in the structured and unstructured data processing, indexing, and fast search, personalized filtering. In the conclusion, the patient record search in the EHS plays a virtual role in the improving healthcare efficiency and decision making. It allows healthcare providers to access comprehensive patient data quickly, enhancing diagnosis and treatment. Advanced technologies like AI and NLP helps to refine such capabilities. Coming to the next slide. future trends and innovations in the healthcare IR, multimodal integration and personalized recommendations, perspective analysis. The personal, medical, and health and technology information to enhance patients' care and accessibility. These technologies and remote monitoring will empower patients to manage their healthcare in real time. The data interpreters will improve the care conditions access providers. The conclusion will give by the Chandana Kajjala.